In an age of advanced medical techniques, it's usually fairly easy to determine a person's cause of death, and there's a legal responsibility for this to be recorded at an inquest. Everything is investigated and substantiated by both highly trained medical professionals and police. While mysterious deaths do occur, the mystery is not usually the cause of death, but whether it was accidental or planned. But back in medieval London, things were a lot different. For a start, life expectancy was much shorter, especially for the poorer classes. You would be considered an old-timer if you lived past 50. And in those 50 years, your access to proper medical assistance was extremely limited. Those from the middle and upper classes would often have their own physician, who they would pay privately. But even then, it was pot luck whether you got the right doctor or the right treatment. One royal physician, for example, from the 14th century, John Ardern, known even today as the father of modern surgery, once prescribed hot plaster smeared with honey and pigeon dung as a cure for kidney stones. In 16th century London, the advice given to a patient suffering severe toothache was to hold a flame near the tooth, and the worms that were gnawing inside would be burned. Remedies for various illnesses, especially mental illness, included bloodletting, emetics, forcing the patient to vomit, and trepanning, drilling holes into the skull to let out evil spirits. Or there was the classic religious fallback position. The doctor would give his professional opinion that you were cursed, probably because of some unspecified lack in your moral integrity, and that you should get your family to pray for you, or take you on a holy pilgrimage to sacred places like Lourdes in France. And that was just the regular doctors. The medical profession would be largely unregulated until the end of the 18th century, and there were an awful lot of quacks and charlatans around, snake oil merchants, especially in big cities like London, who would take advantage of this generalized medical ignorance. A quack was someone who considered themselves a real doctor, despite any obvious training or knowledge, and could easily kill you through well-intentioned ignorance. But a charlatan would know exactly what his so-called medicines might do to you. For example, in 1660, a London charlatan called Lionel Lockyer claimed to have captured the healing properties of the sun, the fiery globe's literal essence, in a pill, which he called Pilula Radis Solis Extracta, to make it sound fancy. He claimed it would cure almost any illness, including cancer and leprosy, and people bought into it in a big way. We still don't know exactly what was in those little pills of sunshine, but it allowed Dr. Lockyer to die a wealthy man with an elaborate tomb in Southwark Cathedral.